The cause of death was listed as a sudden cardiac event. The medical examiner disagreed, identifying the actual cause as an IVC filter migration, resulting in fatal hemorrhage from aortic penetration years after implantation. This case underscores the critical importance of long-term patient follow-up and documentation for devices such as inferior vena cava (IVC) filters, initially placed to prevent pulmonary embolism by trapping blood clots. This particular device migrated from its intended location within the inferior vena cava, piercing through into the aorta. This migration occurred due to known issues with filter stability over extended periods, documented in FDA adverse event reports. The initial ruling was an accident. However, forensic evidence revealed a pattern of medical oversight and omission bias, where past interventions are forgotten as they no longer present an immediate concern. This episode delves into the fatal consequences of such negligence and the broader implications for patient care and device safety protocols. Chapter: Case Background. The incident occurred on March 15, 2023, in a bustling suburban hospital near Pittsburgh, Pennsylvania. The deceased was admitted to the emergency department, complaining of sudden and severe chest pain radiating to the back. Initially assessed by an internist, the presenting symptoms were attributed to possible cardiac ischemia or musculoskeletal strain due to recent physical exertion. Diagnostic imaging conducted at 9:00 p.m. revealed a significant hemorrhage in the thoracic cavity. Upon further investigation, it was discovered that an inferior vena cava (IVC) filter, implanted years prior for prophylaxis against pulmonary embolism, had migrated from its intended location and pierced through the aortic wall. This unexpected migration resulted in fatal internal bleeding. The case came to light when the deceased's medical records were reviewed during the emergency procedure. Notably, the initial treating physician did not consider the possibility of device-related complications due to the temporal distance between the filter implantation and the current presentation of symptoms. Chapter: Initial findings upon arrival at the scene. First responders noted a 58-year-old male found supine on his bedroom floor with no visible external injuries indicative of trauma. The deceased was pale and unresponsive, with signs of acute blood loss, but without obvious puncture wounds or lacerations to explain the hemorrhage. Initial medical assessment by emergency services revealed a sudden drop in blood pressure consistent with internal bleeding, leading to immediate transport to the emergency department. In the hospital, imaging studies conducted post-mortem identified an intravascular foreign object piercing through the thoracic aorta, causing fatal hemorrhaging into the mediastinum. The initial manner of death was classified as undetermined pending further investigation due to the absence of external indicators and the presence of this unexpected internal mechanism. Review of medical records indicated a history of pulmonary embolism treatment 5 years prior involving the placement of an inferior vena cava (IVC) filter, prompting a forensic pathology examination focusing on potential device migration. Chapter: Forensic investigation at the time of discovery. A medical alert bracelet indicating an inferior vena cava (IVC) filter placement several years prior was present on the deceased. The physical examination revealed no external signs of trauma or recent surgeries. Postmortem imaging demonstrated the presence of an IVC filter that had migrated from its intended position and perforated the thoracic aorta, leading to fatal hemorrhage. Blood-stained surgical gauze and clots were collected from around the thoracic cavity during autopsy, confirming internal bleeding. Medical records showed no recent consultations related to vascular issues or device malfunctions. The chain of custody was meticulously documented, with evidence sealed and stored according to forensic standards. Notably absent were any signs of acute medical intervention prior to death, suggesting the migration and subsequent hemorrhage occurred without immediate recognition by medical providers. Autopsy examination revealed a fractured inferior vena cava (IVC) filter with evidence of migration and penetration through the abdominal aorta. Radiographic imaging confirmed the presence of metal fragments consistent with the device's components, corroborated by CT scan analysis showing hematoma surrounding the aortic lumen. Histological sections from tissue samples demonstrated hemorrhagic necrosis indicative of acute blood loss near the puncture site. Hemoglobin levels in pericardial fluid were elevated at 180 mg/dl, consistent with significant intrathoracic bleeding. Blood clot formation was evident within the IVC and aorta, suggesting thrombosis secondary to vascular injury. Scanning electron microscopy identified metal debris from the device's fracture points embedded in arterial walls, confirming mechanical failure as the cause of fatal hemorrhage. The forensic examination revealed that the deceased had undergone placement of an inferior vena cava IVC filter approximately 5 years prior to death. Radiological imaging indicated a migration of this device, resulting in penetration through the abdominal aorta, which caused fatal hemorrhage. The postmortem interval was estimated at less than 24 hours based on livor mortis and rigor mortis progression. This timeline confirmed the recent onset of symptoms consistent with acute internal bleeding shortly before death, corroborated by medical records showing an unexplained drop in hemoglobin levels days prior to the fatal event. It contradicted initial assumptions that the deceased's sudden deterioration was unrelated to previous surgical interventions. The presence of documented IVC filter migration cases in FDA databases further supported this investigative conclusion. The forensic examination revealed a fractured and displaced inferior vena cava (IVC) filter within the thoracic cavity, with sharp edges piercing through the aortic wall, leading to fatal hemorrhage. The timeline of medical records indicated the device had been implanted several years prior to the incident. Radiographic evidence confirmed migration consistent with documented reports of IVC filter complications in the FDA database. Expert testimony would corroborate that while initial placement was medically indicated, subsequent oversight and follow-up were critical. The expert would assert under oath that the failure to monitor and address the device's migration constitutes a breach of standard medical care protocols. This conclusion is supported by both objective forensic findings and clinical evidence, distinguishing between conclusive data from imaging studies and interpretive assessments based on clinical records and FDA reports. Chapter Resolution. The investigation concluded that the fatal hemorrhage resulted from the migration of an inferior vena cava (IVC) filter, which had been implanted years earlier to prevent pulmonary embolism. The evidence revealed that the device, no longer anchored securely within the IVC, migrated superiorly and perforated the aorta, leading to catastrophic bleeding. Radiological imaging confirmed the position of the filter relative to other anatomical landmarks at multiple time points, documenting its gradual displacement over several years. Initially, medical records indicated no immediate complications post-implantation, but subsequent imaging during unrelated procedures revealed the migration. The central finding was established through a comprehensive review of patient history and radiological progression. Device failure reports within the FDA database corroborated the likelihood of filter migration as a known risk, despite previous assurances of long-term stability. The final determination highlighted the critical role of ongoing medical surveillance for devices such as IVC filters, emphasizing the importance of recognizing potential risks over time rather than relying solely on initial assessments. This case underscores the psychological tendency to overlook past interventions when they are not currently causing issues, a phenomenon known as omission bias, which can have fatal consequences if ignored. This case underscores the critical importance of comprehensive medical record reviews and longitudinal patient monitoring, highlighting potential long-term complications from previously implanted devices. The omission bias illustrated here serves as a cautionary reminder for healthcare providers to revisit past interventions systematically. The file remains open,